Why is a comprehensive physical assessment so vital in healthcare? A physical assessment not only helps in diagnosing a patient's condition, but also gives an insight into their overall health status. This guide will walk you through a systematic approach to physical assessment by body systems. We begin with the general assessment. This includes observing the patient's overall appearance, behavior, and body structure. Look for signs of distress, such as sweating, pallor, or shortness of breath. Pay close attention to the patient's level of consciousness, orientation, and speech. Moving on to the skin, hair, and nails. The skin is the largest organ of the body and can provide invaluable clues about a patient's health. Look for primary skin lesions such as macules, papules, and vesicles. Secondary skin lesions such as scales, crusts, and scars may indicate a disease progression or healing process. Hair and nails can also reveal nutritional deficiencies or systemic illnesses. Next, the head and neck. Start by examining the anatomical landmarks of the skull, such as the frontal, parietal, and occipital bones. Then proceed to the lateral head and neck, focusing on the mastoid process, sternocleidomastoid muscle, and the cervical lymph nodes. Lastly, assess the anterior neck, observing the thyroid gland and trachea. The eyes, often described as the window to the soul, can reveal a great deal about a person's health. Use an ophthalmoscope to examine the longitudinal cross-section of the eye, focusing on the optic disc landmarks. Look for abnormalities in color, shape, and size that could indicate pathologies like glaucoma or optic neuropathy. The ears not only have a role in hearing, but also in maintaining balance. Examine the external ear landmarks such as the auricle and external auditory canal. The tympanic membrane landmarks, including the umbo and cone of light, provide information about the middle ear's health. Lastly, the nose and throat. Start by observing the external nose for symmetry, lesions, or deformities. Inside the nose, look for polyps, discharge, or swelling. The throat examination includes assessing the dentition of deciduous teeth and their sequence of eruption. Also, observe the upper deciduous teeth for cavities, malalignment, or discoloration. In conclusion, a thorough physical assessment involves a systematic examination of each body system. It starts with a general observation, followed by a detailed examination of the skin, hair, and nails. The head, neck, eyes, ears, nose, and throat assessments provide crucial information about a patient's overall health. Remember, a comprehensive physical assessment not only helps in diagnosing a patient's condition, but also gives an insight into their overall health status. So always take your time and be thorough in your examination. Our next focus is the chest and lungs examination. We start by identifying the topographical landmarks of the thorax, which include the clavicles, the sternum, and the ribs. These landmarks are important as they provide a relative location for underlying organs and structures. Next, we move to percussion tones of the thorax. This involves tapping on the patient's chest and listening to the sounds. Normal lung tissue produces a resonant sound, while areas filled with fluid or solid material may produce dull or flat sounds. Then, we listen to the breath sounds over lung fields. These sounds are usually classified as vesicular, bronchial, and bronchovesicular. Any changes or abnormalities in these sounds can indicate a potential lung condition. Lastly, we listen to any adventitious breath sounds. These are abnormal sounds that are heard over a patient's lungs and airways. They include crackles, wheezes, and pleural friction rub. These sounds can provide clues to various lung conditions like pneumonia, asthma, or bronchitis. Remember, a thorough chest and lungs examination can reveal a lot about a patient's respiratory health. So, always be systematic and meticulous in your approach. In this segment, we move on to the heart and blood vessels examination. This involves a systematic approach to assess the cardiovascular system of our patients. We begin with the palpation areas for cardiac examination. These include the apex, left sternal border, and base of the heart. The purpose of palpation is to assess the size, location, and strength of the heartbeat. Next, we discuss the anatomical and auscultatory valve areas. These are the aortic, pulmonic, tricuspid, and mitral areas. Using a stethoscope, we listen for the normal heart sounds, known as lub-dub. The lub sound is caused by the closure of the atrioventricular valves during ventricular systole, which is the contraction of the ventricles. The dub sound is due to the closure of the semilunar valves during ventricular diastole, the relaxation of the ventricles. Any additional or abnormal heart sounds, such as murmurs, may suggest heart disease or other cardiac conditions. Remember, a thorough heart and blood vessels examination can reveal a lot about a patient's cardiovascular health. Therefore, it's crucial to be systematic and meticulous in your approach. This will help you identify any potential abnormalities and provide the best care for your patients. In the next segment, we will delve into the examination of the abdomen, which is another critical part of a physical assessment. As we continue our comprehensive physical assessment, we now turn to the breast and axilla examination. This is a crucial aspect of the examination, as it can help identify any changes or abnormalities in the breast tissue and lymph nodes, which could be indicative of conditions such as breast cancer. We begin by visually inspecting the breast tissue for any changes in size, shape, or symmetry. We also look for any changes in the skin, such as dimpling, puckering, or discoloration. Next, we move on to palpation of the breast tissue. It's important to use a systematic approach, moving in a circular pattern from the outer edge of the breast towards the nipple. We're checking for any lumps, masses, or areas of tenderness. Remember, some women have naturally lumpy breasts, and this is normal. However, a new lump or a lump that changes in size or shape could be a cause for concern. After the breast tissue, we move on to examine the axillae or armpits. We palpate these areas to feel for any enlarged or tender lymph nodes. The lymphatic drainage of the breast primarily goes to the axillary lymph nodes, so it's crucial to include this in your examination. In the upcoming segment, we will discuss the examination of the abdomen, another pivotal part of the physical assessment. Remember, a thorough and systematic approach is key to providing the best possible care for your patients. Transitioning from the breast and axilla examination, we now proceed to the abdomen examination. The abdomen houses many vital organs, including the stomach, liver, gallbladder, spleen, pancreas, kidneys, intestines, and bladder. A comprehensive abdominal examination can provide valuable information about the health of these organs. We begin with a visual inspection. Look for any distension, asymmetry, or visible masses. Also, observe the skin for any changes such as scars, stretch marks, or discoloration. The presence of dilated veins could indicate portal hypertension, a serious condition often associated with liver disease. Next, we move to auscultation. Using your stethoscope, listen for bowel sounds in all 4 quadrants of the abdomen. Normal bowel sounds are gurgling noises that occur irregularly anywhere from 5 to 30 times per minute. Absence of bowel sounds could indicate a serious condition such as bowel obstruction. Following auscultation, we proceed to palpation. Light palpation is used to assess for areas of tenderness, muscle tone, and surface characteristics. Deep palpation helps to identify any masses and the size of the organs. Always remember to ask the patient if they feel any pain or discomfort during this process. Lastly, we perform percussion. This technique is useful for determining if the underlying tissues are filled with air, fluid, or solid material. Remember, the abdomen examination requires a gentle but thorough approach. In our next segment, we will delve into the examination of the musculoskeletal system. Stay tuned for that. After thoroughly examining the abdomen, we now venture into a delicate but fundamental part of the physical assessment: female genitalia development. This area is crucial in assessing sexual maturity, identifying any abnormalities, and in reproductive health. Females undergo a series of changes during puberty under the influence of hormones, primarily estrogen. These changes manifest physically and are collectively known as secondary sexual characteristics. The most noticeable changes include the growth of breasts, which we've already covered in a previous section, and the development of pubic hair. In addition to visible external changes, there are significant developments within the female reproductive system. The ovaries start to produce eggs, and the menstrual cycle commences. The uterus and vagina grow in size, and the vaginal walls thicken. When assessing female genitalia development, we look for signs of these changes. A typical evaluation would include assessing the growth pattern and distribution of pubic hair and noting any abnormalities in the external genitalia, such as unusual discharge or lesions. Always remember, this examination requires the utmost respect and sensitivity. It's essential to explain the process thoroughly to the patient and ensure their comfort and consent before proceeding. In our next segment, we will explore the examination of the male genitalia. Stay tuned as our comprehensive physical assessment continues. Having covered the female genitalia development, it's essential to understand the parallel processes in males. The development of male genitalia is a crucial part of a comprehensive physical assessment. This development is primarily driven by the hormone testosterone, which triggers the growth and maturation of the male reproductive system. The most noticeable changes include the enlargement of the testes and scrotum, followed by the growth of the penis. Pubic hair also starts to grow and follows a distinct pattern. Internal changes include the ability to produce sperm and the deepening of the voice as the larynx or voice box grows. When conducting an examination of the male genitalia, we look for signs of these changes and assess their progression. It's important to note any abnormalities such as lumps in the testes, which could be a sign of testicular cancer, or phimosis, a condition where the foreskin can't be fully retracted over the head of the penis. As with the female examination, this procedure requires respect, sensitivity, and informed consent. It's crucial to explain the process to the patient and ensure they are comfortable before proceeding. In the next segment, we will continue with our comprehensive physical assessment, focusing on the musculoskeletal system. Stay tuned to learn more about this fascinating aspect of human health. After examining the male genitalia, we must not overlook the importance of the anus, rectum, and prostate in the male reproductive system. The anus and rectum play a crucial role in the expulsion of waste from the body, while the prostate is an essential gland within the male reproductive system. During puberty, the prostate grows in size, facilitated by an increase in the male hormone testosterone. The prostate is responsible for producing a fluid that nourishes and protects sperm. During a physical assessment, a digital rectal examination is usually performed to check the health of these areas. The doctor will insert a lubricated, gloved finger into the rectum to feel for any abnormalities. This examination can detect problems such as hemorrhoids, anal fissures, and prostate disorders. Regular checkups are vital for early detection of diseases such as prostate cancer, which is one of the most common cancers in men. As with the previous examinations, this procedure requires sensitivity, respect, and informed consent from the patient. The doctor should explain the process, ensure the patient is comfortable, and respect their privacy during the procedure. In the next scene, we'll move on to the musculoskeletal system, where we'll explore the structure and functions of the human skeleton and muscles. Stay tuned to gain a deeper understanding of this complex system. In this next part of our comprehensive physical assessment, we're moving away from the internal systems to the musculoskeletal system. This system, made up of bones, muscles, and joints, is responsible for giving our bodies structure, allowing us to move, and protecting our vital organs. We'll start by looking at the skeletal structure, which includes the axial and appendicular skeleton. The axial skeleton consists of the skull, vertebral column, and rib cage, while the appendicular skeleton comprises the limbs and girdles. Next, we'll examine the muscular system, which works in cooperation with the skeletal system to facilitate movement. We have more than 600 muscles in our body, and each has a specific function, from allowing us to lift heavy objects to helping us maintain our balance. Finally, we'll look at the joints which connect our bones and allow for movement. These can be categorized into 3 types: fibrous, immovable; cartilaginous, partly movable; and synovial, freely movable joints. During a physical assessment, the healthcare provider will check for any abnormalities in the musculoskeletal system. This could include checking your posture, gait, and joint mobility. They'll also look for signs of swelling, redness, and tenderness, which could indicate problems such as arthritis or other musculoskeletal disorders. Understanding the musculoskeletal system is not just about knowing the bones and muscles in our body. It's also about understanding how these structures work together to allow us to move and function. So join us as we delve deeper into this fascinating system in our next scene. As we continue our comprehensive guide to the physical assessment, we turn our attention to the functional assessment of the musculoskeletal system. This critical aspect of any physical examination involves assessing range of motion, strength, and flexibility. Firstly, let's talk about range of motion. During this part of the assessment, the healthcare provider will ask you to perform various movements to check your joints' flexibility. These movements could include bending, straightening, rotating, or moving your limbs in specific directions. Any restriction or pain during these movements could indicate a problem with the joint or surrounding tissues. Next, we move on to strength assessment. In this phase, the healthcare provider will ask you to resist against their push or pull to test the strength of your muscles. This test can help identify any muscle weakness or imbalances that could potentially lead to injury or other health issues. Lastly, we assess flexibility. This is an important part of maintaining a healthy musculoskeletal system, as it helps prevent injuries, improves posture, and aids in performing daily activities. The healthcare provider may ask you to perform certain stretches or movements to evaluate your flexibility. Remember, a thorough functional assessment of the musculoskeletal system is not just about identifying issues. It's also about creating a baseline that can help track progress over time or detect any changes in the future. So as we move through each movement, remember to take note of any discomfort, limitations, or asymmetry, as these could be signs of underlying issues. Let's continue to uncover the mysteries of the human body in our next scene. As we delve deeper into our comprehensive guide, our next stop is the complex yet fascinating world of the neurological system. This system, composed of the brain, spinal cord, and nerves, controls all the workings of the body. It's the mainframe that receives, processes, and transmits information, enabling us to interact with our environment and regulate our bodily functions. To start, the healthcare provider will assess your level of consciousness, orientation, and memory. This can provide vital clues about your brain's functioning. Next, they will examine your cranial nerves, which supply the face and neck. This includes checking your vision, facial strength, hearing, taste, and more. Any abnormalities here can indicate potential neurological disorders. Continuing with the examination, the healthcare provider will evaluate your motor function. This includes assessing your muscle tone, strength, and coordination. They'll look for any signs of weakness, tremors, or other abnormalities. Furthermore, the healthcare provider will test your reflexes. This simple yet essential test can expose problems in the nerve pathways that control these reflexes. Lastly, the healthcare provider will assess your sensory function. This involves checking your ability to feel various sensations such as touch, pain, and temperature differences. Any changes in sensation can point towards potential nerve damage or neurological disorders. Remember, a neurological examination is a crucial part of a comprehensive physical assessment. It helps in identifying any abnormalities that might require further investigation and treatment. As we journey through this fascinating system, take note of any unusual findings, as these could be telltale signs of underlying issues. Stay tuned for more as we continue to unravel the intricacies of the human body.